Well, hi, everybody, and welcome to the podcast. I'm Marcy Markusa, and we're continuing to dig into the challenges with our healthcare system in Manitoba in a really detailed way as we learn and understand even more about our emergency rooms. And specifically, when people get there, it's one thing, but how do they leave there? One of the challenges is people who are in emergency room department beds, and they actually are simply waiting for care in a personal care home. This is Manitoba. So we've had a long-standing issue with the number of personal care home beds in this province, and that's our first interview on the podcast today. We heard from Dr. Shawn Young on a previous podcast. He's the Chief Operating Officer at the Health Sciences Centre. He says his emergency room at HSC isn't the only care facility that's struggling to keep up with demand. Personal care homes are struggling as well. And so this sets up our interview, this clip of Dr. Young, because he talks here about the ripple effect that goes on throughout our entire healthcare system. And he says it is only getting worse.
We're all struggling with the same challenges with a lot of patients in hospitals that we can't get them into their next phase of treatment, whether it's rehab or long-term care or home care. So all our hospitals are quite full of patients that don't actually need a hospital anymore. We call them ALCs, alternate level of care. And that number is not getting better, and that's a concern. So we do definitely need those services beyond the hospital to be beefed up. I think our biggest challenge right now that the government can help us with is helping us with the home care, the long-term care. What is causing us the access block and the alternate level of care numbers to be so high? And there's 25% of the patients at a health science center that have been there for over a month, many over 2 months, that need those facilities to be opened.
My next guest is Sue Vovchuk. She's the Executive Director of the Long-Term and Continuing Care Association of Manitoba. That's a nonprofit that advocates for personal care homes all across the province and the thousands of people who rely on them. Thanks for being with us via Zoom this morning, Sue. Appreciate it.
Thank you for inviting me.
So what is your reaction to, to hearing Dr. Young there talk about, questioning where the backlogs are and looking at this?
Unfortunately, Marcy, this is not new. This has been an issue. I mean, prior to this position, I worked in government for over 30 years. This has been a long-standing issue with folks transitioning to the next level of care from hospital. I think the misnomer is that, our personal care homes are full. The other piece, when you're talking about folks, it was specifically with Dr. Young talking about folks in HSC, a number of those folks are not only waiting for a regular personal care home bed, but a specialty bed, whether that be a special needs unit, special needs behavior unit, or chronic care. So it's not a black and white issue. There's a lot of complexity involved. Having said that, the complexity of care for the folks transitioning into long-term care is only increasing as well.
So we know this. We knew this would happen. I mean, we've done story after story here at CBC about the boomer generation going to be aging into the system as well. And what do we do? And not enough beds. So what is the current state of Manitoba's long-term care system? Like, where are we at? There are some builds in the works, but I understand that your term for this is like we are in crisis mode right now.
Well, we really are. We're very grateful, and there have been two announcements from the current government for one new build in Lac Tabani for 95 beds, and they're expanding Park Manor to another 90 beds. But we are short, and I guess the frustration is, as you said, we've known the tsunami's coming, and we're just not prepared. The new beds are one part of the situation, but the other part is we have 124 personal care homes in Manitoba, and we're talking old infrastructure. So we need to be looking at a funding model that appropriately funds, but looking also at capital investment to ensure we are modernizing the aging infrastructure. Because coupled with all of this as well is best practice. We know that best practice and evidence base is telling us small house models is how we should be caring for older adults in long-term care. We should be looking at person-directed living, all those pieces. But our current PCH stock, some of them have 50-bed units. We're talking about the necessity of 10-bed units. So where is that money coming from to modernize our existing infrastructure? Because we are on a precipice of a crisis. And you said, part of us is we're really frustrated because we've known the tsunami is coming, correct?
Well, we all have known the tsunami is coming. And then obviously during COVID across the whole country, I would argue that we started really leaning into what's going on in care homes and the need for,
Yeah.
what kind of care we need. The space issue is interesting to me because I don't think people would have realized maybe that necessarily that there's people that are in hospitals and even in the ER department that are waiting. I know our I-team did an investigation at one point talking about paying the hospital for the stay, like it's a care home, but you're not in a care home. So we have lots of issues. Where do you see the solutions lying? I mean, not just to stay with the problems here, but is this just about funding? Like, where do you see the solutions?
I think part of it's funding. I mean, a big part of it is funding for the current personal care homes, because they're funded for 18% for benefits for staff when it costs 22%. We're talking about in a non-index funding formula, so we're talking about the inflation, all those pieces. But a part of that is we want to work with government to be part of the solution. I mean, there's some immediate fixes that could happen, even looking at other models of care like supportive housing. Like right now, we have a social model of care for supportive housing, which is staffed by tenant companions. We've had on the table, for the last 4 years, asking to get funding to upgrade that to healthcare aides. By just doing that takes some pressure off the personal care home beds because more people can go into that model of care. So there are some immediate solutions that are available. So we want to work with government, use the expertise we have, because you're right, we can't sit here and perseverate just on the problems. We have to be starting looking at solutions and innovations, like what can we do? And not all of it's complicated. It really isn't. There's some easy fixes. I'm
going to just ask you to clarify here, because I think if an average listener's, I need clarity. So sure. maybe listeners do as well. When you say that adding healthcare aides into supportive housing could be part of the solution, can you clarify supportive housing? Because some people might be thinking, does that mean assisted living or seniors block? Like, can you clarify what you mean? For sure. No, supportive housing, there's 10 in Winnipeg, but we have, multiple sites throughout the province. But there's small house models. There's 12 tenants to a unit. So right now they're staffed by tenant companions, but do not have healthcare training. So they're there to provide, meals, bubble packed medications, recreational programming, but not actually any healthcare. That comes from the home care system. So if we just change that model to a healthcare aid, we could increase the complexity of folks that could transition into that type of housing. How long is the wait list for a personal care home bed in Winnipeg right now? It depends. Right now, they're averaging nine beds become available a day, and those 9 beds are taken. So it really depends on, like I said earlier, if you're waiting for a specialty bed or a regular personal care home bed. And the wait's different if you're waiting from community or from hospital. So again, it varies. Is it longer if you're waiting in hospital or in community? It depends what you're waiting for, because in a community, you can wait for your preferred choice. In hospital, once you, like what Dr. Young was mentioning, once you've been determined by acute care as ALC, ready to transition to another level of care, your panel for personal care home. But the expectation is then that you accept the first available bed in the long-term care setting. How big of a problem is this in rural Manitoba right now? It's a problem across the province, because in rural Manitoba, I mean, they have so many folks that are waiting in their hospitals for personal care home beds. They have less beds. And there's also, for specialty beds, they place a provincial demand on the Winnipeg beds, because the outside of Winnipeg, in the small towns, they don't have access to special needs units, special needs behavior units, chronic care. So those folks that have specialty, they're waiting for beds in Winnipeg. So this is a provincial issue, absolutely. And the aging infrastructure is right across the province. Sorry, Marcy. No, please go on. The other piece of that is, talk about funding. We're looking for a consistent funding model for personal care homes across the province as well. I was going to ask Sue if you have anything to add before you go this morning that you feel is important to say. Well, the piece is it's funding. I mean, I said the new build announcements are welcomed. We appreciate that, absolutely. But what do we do to modernize our infrastructure? Because, like I said, we're in a crisis. We need to work with government to address this as soon as possible. And will modernizing infrastructure add space? Because if we're talking about moving people in, people do equate this to beds, right? Well, yeah,
It'll improve care for sure. It could also improve the number of specialty beds, which will positively impact flow from acute care.
Thank you very much for being with us. Really appreciate your perspective.
You're welcome. Thank you so much.
Well, up next on CBC, Muslim students at the University of Manitoba are gathering together for a very special and spiritual reason this week. They're celebrating Islam Awareness Week. That's an annual event that's held on campuses and in communities all across Canada. The goal is to, and I'm quoting here, explore the beauty of Islam. But this year, Ayesha Sultan says that the week is especially poignant. She says it's crucial to confront what she sees as a rise in Islamophobia. Ayesha Sultan is president of the University of Manitoba's Muslim Students Association and in studio with us. Good morning.
Good morning, Marcia.
And Bareera Kamran is with us as well, the association's manager of student life. Good morning to you.
Good morning to you as well.
So, Ayesha, let me start with you because I mentioned, something that you were thinking about. But I actually want to start with the first thing I said, exploring the beauty of Islam, that being Islam, the sort of thinking around the week. What does that mean to you when I say that, exploring the beauty of Islam?
Yeah. So this is something what our actually media manager posted as well on our Instagram and social media, talking about the Islam Awareness Week and indicating the beauty of Islam. And for us, or even for me, when we say beauty of Islam, it has so many things. It is a knowledgeable religion, a religion filled with discipline, lifestyle, equality, equity, and it has so much beauty in it, especially from talking to, let's say, elders or talking to the youngest person we are being taught about those things and how to respect each other. So it's a religion of peace and loving each other for the sake of Allah, our God. And that is one of the beauty. And most importantly, for me personally, it's how everyone is equal in Islam. So when we go and pray, everyone who is even the richest person on earth or even someone who has a really normal lifestyle, they would come in and stand together in the same line and they would pray and they would bound themselves. And we know the purpose when we all come together to pray as well. It's purpose for our God. So when we come together and stand and forget about the worldly things we have and we're just so humbled and knowing the purpose of our life and knowing that beauty that holds within it's so beautiful for us.
You say that message, though, is being lost right now somewhat.
Exactly.
In a wider way, that, the education and awareness about Islam to you is crucial as your language. Tell me more about that, what concerns you right now.
Currently, the concern that we are facing in the day and time that we are in nowadays, Islam is, again, a beautiful religion. It has so much beauty towards it and so much to learn from it. But unfortunately, the light that it's being under right now, it's causing it for people to get scared away or maybe have some fear, which is causing the Islamophobia. And the definition of Islamophobia is hatred or fear towards a Muslim or Islam. So which means there's a lot of stereotypical narratives or negative narratives that come through or microaggression that can come through. So a person like me who is a visible Muslim, it's a person like Bareera who's a visible Muslim who's wearing a hijab, or even men, like they have really common name, Muslims like Muhammad, my brothers, Hamza and Talha, they have such a common Muslim name. So people who are easily identified, which is Muslims, they can easily get hatred or maybe feared of, which is not something that we are representing, which is not something we are learning as well.
Bareera, you've been nodding the whole time as well. Tell me a little bit about your feelings around this, the misconceptions and that you really would love to dispel.
Yeah, no, what Ayesha mentioned, I totally second all of that. The fear, the misconceptions are, like for me personally, as some people think, as a Muslim woman who loves to cover and wear the hijab, I wear a dress all the time, which is called an abaya. So people think, oh, maybe I'm oppressed, or, sometimes I also feel like maybe I'm seen at less than, like in my classes, just because I'm fully covered. They would think, oh, maybe I come from a background where I'm oppressed to dress like that. I may not have a voice of my own, may not have opinions of my own.
And how do you know that? Do people say things to you?
Yeah, people, it can be seen in people's, the way, how much, space they give you to share your thoughts, how much they are, responding to you if you say something, how much they're taking into account what you are saying, or maybe they're just moving on to the next person, and, giving more space to their thoughts and their feelings rather than mine. So this is observed a lot of times in many different settings.
Which is partially why of course, we're talking about this week and the importance of all of what you're going to be sharing to educate people. You're organizing different themes every day, I understand, to focus on. Tell me a bit about the themes.
Yeah, so this is for our Islam Awareness Week, which is to spread awareness about Islam. This week was ongoing from February 10th to 14th. And we have different themes. So Monday was our 5 pillars of Islam. We started off just talking about the base or foundation of what Muslims believe in and 5 pillars. And then Tuesday was our Modesty in Islam Day, where we talked about modesty for men and women. And I named it not just like modesty for women because I really wanted to emphasize how Islam focuses on modesty for men and women, which is also another misconception. People think, oh, only women cover up, but our religion also have guidelines for how men should present themselves or cover up or what modesty means for them. I really wanted to, bring focus to that. And then Wednesday is expected to be the Rewords Day. So
Revert Day, what is that?
Yeah, revert in Islam, we refer to people who were not Muslim previously or were not born as Muslim, but they converted to their religion. We refer to them as reverts. And the main reason for organizing this is at our university, there's a lot of people from diverse backgrounds who may not look like me or, maybe if somebody thinks of a Muslim, maybe there's a traditional image that comes to their mind of a Muslim. Maybe they don't look like a certain way and they come from very diverse backgrounds, and I really wanted those people to be at the MSA table. We're having these tables throughout the campus every single day.
You're set up on campus,
yeah. So I wanted people to see those people from diverse backgrounds and actually maybe if somebody looks like them on the table but they are wearing a hijab, they would be more open to reach out to those people and see that Muslims come from all diverse backgrounds. And that's also talks about the beauty of Islam that Ayesha was talking about.
And then round out the week, because we're almost finished. Thursday, Friday. We're almost finished with the week, that is.
Yeah.
What are your themes for Thursday, Friday?
Thursday, wanted to talk about lifestyle as a Muslim, and that is a very broad topic, and that day we are also encouraging everybody to fast. It's a sunnah, or we call it a practice of the Prophet Muhammad that Muslims believe in as the last messenger. So it's a practice of him to fast on Mondays and Thursdays. And fasting is already proved to have so many benefits. People do it, even non-Muslims do it for non-religious purposes. And this is also just to help people prepare for Ramadan that's coming up, which will be 30 days of fasting. So we thought, let's just put a fasting day there, encourage everybody to fast, just to, get in the feel of fasting.
What has it felt like at the booth so far as you've been interacting with other students? Either what are they most curious about, or what's it felt like for you to, in a positive way, be able to share, with people, Ayesha?
Yeah. So we had one of our booths in Fletcher, which was our first day, and we had a lot of students who were genuinely curious about the religion, which was really good. And either they were studying religion or they were majoring in something that was closely related to it. So they came in with a lot of curiosity, a lot of intention to learn about the religion. And when we saw that positive encouragement or their attitude towards us and learning about this religion was a really good feeling to see how our campus is evolving and they're actually more open to have this discussion and talk about it more effectively.
Amazing. Bareera, what's it like for you when you're in class and you feel like you were saying less than? How hopeful are you that this whole week might change that for you?
Oh, I'm very hopeful that this week has a positive impact, because a lot of people who come at the table, sometimes they're a little bit hesitant, and we invite them and we tell them, we preface our conversations by saying, we're not here to convert you. We don't want you to be converted into Islam. We just want to share what we are, or what we think. And then we start the conversation by asking people, hey, do you know anything about Islam? Or do you want to learn anything about Islam? And in the beginning, people are a little bit hesitant, but once you start the conversation and make sure and, reassure them that we're not converting you, we're not challenging your ideas, we're not trying to target you or your beliefs, we're just trying to share what we believe in. Then they open up and get comfortable. And on the table, we have had people talking to one of our volunteers for 3 hours. One person brought up his Bible, and he was sharing what he knows about his religion, and we were sharing what we know and the commonalities. And so the conversations are just beautiful and very eye-opening.
Now, there is something that we have to talk about just in the last minute here before you two go, because you have a need. So the Muslim Students Association, Ayesha, is preparing for Ramadan, as mentioned, to support. What do you need to support the Muslim community on campus? Because you and I touched on this a bit when we met at U of M during Communities in Focus. You need space, right?
Yes. So currently, yes, space is still what we're looking for and advocating because, as you said, it's a 30-day of Ramadan, and then we have a lot of students who are coming in. Even after our discussion, we started looking into stats more effectively on that one Friday prayer, and we're getting to know there are about 900 people come around for one prayer. So again,
How big? Whoops, 900 people for one prayer. How big is your space right
250.
now?
And
Ooh,
that's what
wow.
we're still struggling with, right? So even as an executive, our full team worked hard on trying to get an understanding of how we can move forward with it. And we got to know, okay, there are 900 and we need to move towards a bigger space, at least for one day. Or now when Ramadan is coming for 30 days, we need to still find a space. So I'm not sure how, but our team is effectively working. We have an incredible team, full board of executive directors and volunteers.
And remind me right now what happens then. I mean, if 900 people show up, you have space for 250. Are you having to tell students that they can't participate, or?
Unfortunately, they cannot sit with us and eat, but then they have to, again, we can give them the food and they can leave, but they're not allowed to sit because that would create a hazard space, which we cannot do that too.
So you need space. Not sure how you're going to proceed. You're working on it. And do you have enough food?
So for food, we do, we have amazing community members and great organizations who actually help us out with it. We have great people who come and either donate the food or they give us the amount as well for us to purchase the food for them. So for that, we have, again, as I said, we have a full team who always work on these things behind the task or behind the scene. They work really hard for us to actually organize everything every single day.
You have to fundraise though, is that right?
Yes. So we do fundraising. We reach out to the community leaders. We reach out to our amazing collaborators or just the organizations that we work with in general.
So much to think about and so much to appreciate about what the two of you are involved in at U of M. Thank you both for coming and nice to see you again, Ayesha.
You too. It was so nice seeing you, Marcy. And also, I wanted to add one point in. So this Islam Awareness Week, it's not only students doing it. We also have really great collaborators, ICNA brothers and sisters who came in and brought a lot of their hijab for people to try on hijab as well. We have House of Zayd bringing in the thopes to try as well. And I'm not sure
Sister to
Sister for the reword. So
Yeah.
they have a whole organization who are bringing in people who can talk about it effectively to the students. So we're happy to not only do it by ourselves, but have a really great hand of people helping us out too.
Nice to mention all the partners that you have.
Yeah.
And thank you, Bareera. Very nice to meet you.
Yeah, very nice to meet you as well. Thank you for having us.
Thank you.
So that is Ayesha Sultan, president of the University of Manitoba's Muslim Student Association, and Bareera Kamran, the association's manager of student life. Now, if you're online anyway, and you probably are because you're clicking on the podcast, you can check out the University of Manitoba Muslim Student Association in different ways. They're on Facebook under that name. They are also online at ummsa.org, or if you're on Instagram, they're at um.msa. I'm Marcy Markusa. This is Manitoba. Thank you for tuning in today to the podcast, and don't forget to like and share.